It's always hard to follow a comedian, but I will tell you a story. So I'm taking a very important government person around, and those of us that work in administration do that a lot. And I'm showing him all these wonderful things that we do in health, and he's quite puzzled. What is this art school about? Why are they doing stuff with prosthetics, and why are they imagining new kinds of hospital beds, and what's going on here? And I have an eminent professor with me who interrupts my discourse and says to me, no. All we're doing here really is hypothesizing. So I'm standing at the top of a staircase, I'm about to throw myself down, and he says, this is all about the imagination. This is just about the imagination. And I'm saying, no, it's about real outcomes, because actually many of these products are actually developed and used in hospitals and by healthcare systems and so on. Well, the moral of the story is that both sides are correct, that you've got to have imagination to have innovation, you've got to hypothesize and theorize to develop new ideas. And what we do at an art school like Emily Carr is that we invent, reinvent, innovate, redevelop, rethink, and we're always out of sync. In fact, sometimes we're OCD, sometimes we're bipolar, we may even have we may make a decision to brand ourselves as bipolar. I think that would be a really interesting way of talking about creativity. Everybody, by the way, at Emily Carr is dyslexic, and we're all left-handed. So, our big challenge is developing new products, new ways of thinking about healthcare. It's one of our major areas. We're devoted to it. And we have a tremendous number of people, students, who come in and do an incredible amount of work in this area. One of our fundamental principles is dialogue. We're trying really hard to develop new forms of dialogue within the healthcare system. We're a kind of mix of anthropologists, ethnographers, technologists, innovators, playful people that interact, inform, and co-create with a variety of different people across a variety of different mediums. Co-creation is an important part of what we do. We try to work with those people that are in the field. We try to develop, if we're developing a prosthetic, for example, we work with those people that need them. If we're looking at how a hospital bed is designed or how a room is designed, we try to work with the people that actually live inside that space. The model we have is a model that actually incorporates that playfulness to allow us to imagine and not to throw ourselves downstairs, but at the same time, we're devoted to the outcomes that come from that process. The reason it's so important is that design imagines new ways of doing things. This is a vest that was developed by a student for autistic children. It's a vest that you actually hold a teddy bear for. You press the nose of the teddy bear, and suddenly the vest inflates, covers your head, and really grasps you in a beautiful and simple and soft way. It's quite the experience to wear it. It's taken her 5 years to develop the product, and now finally she has, in fact, marketed it, and she has a small company. This is a project we did with the Vancouver General Hospital. You've probably seen it. It's now going to spread around the world, right? Like germs. And it's an amazingly simple way of talking about what you have to do if you're in the health care system, but also it's an amazingly simple way of talking to visitors and patients. Some of the stuff we do is so simple, so direct, the dialogue is so clear. Some of the impediments we face are simply a lack of understanding about multidisciplinarity and how you can bring different people from different disciplines together, how you can bring an artist together, how you can bring a designer together, how you can bring a technologist together. This is a project developed by a student because his grandfather couldn't do the dialysis properly, and he, using 3D printing, which we're masters at Emily Carr, so if you need something printed in 3D, tell us. Using 3D printing, he developed, prototyped, through a whole iterative process of repetition, just a device that would make it simpler for someone with arthritic hands or with sight impairment to actually engage in dialysis with far less of a challenge than otherwise would be the case. He did this because he was motivated not only by the fact that he had a grandfather who had the problem, but he was motivated by the fact that he wanted to use his imagination to figure out a new solution. We work in a variety of different ways. For example, in this slide that you're looking at right now, working with post-stroke adults and working with children with cerebral palsy. What is a school like Emily Carr doing in it? And when I mentioned this to one of the ministers in the government, they said, this is really strange. And I said, well, that's exactly why we do it. And what we're working with is this idea that you can bring together, through these very, very different disciplinary spaces, completely new ways of thinking about it. So home-based therapy, this is not something I can talk to you at great length about, but it's very, very interesting model for thinking about how you can take care of yourself in the home. Applications that allow remote support for a disease like lupus. Very simple app, by the way, that can be developed very quickly. Takes time, but you have to have the training to do it right, but you can do it. This is about innovation and developing new messages. It's about new kinds of thinking about safety and focusing in different ways upon it. It's about looking at messages and understanding how messages work. It's thinking about communication and how communication creates an interactive space for people to experience what they need, what they think they need, and what they want. It's about developing all sorts of different approaches to what we call human-centered design, which links up with a whole bunch of disciplines in engineering and computer science, in the medical area. It's about thinking about behavioral change and how we can introduce behavioral change in the softest way possible without pushing people down a road they don't want to go in. We had a project where we were rethinking the emergency area at the Children's Hospital, and this is not what we came up with, but we came up with something else that began to look at color and space in a different way. And very imaginatively, these are young students who walk in and they really think about space differently. They're not jaded architects. So the message that I want to leave you with is that we can work together. We should. You need the professor who believes he's in a hypothetical world, and you need me who believes that we're in an outcomes-based one. Thank you.